Aloha and welcome to Hawaii Now. The Fertility Institute of Hawaii hosts one of the most successful donor egg programs worldwide and is at the forefront of advances in egg donation technology. It also offers embryo adoption and donation as options for fertility treatment.
Usually we'll get donor eggs from young, healthy, fertile donors. Donor sperm you will get from young, healthy, fertile men who are going to sperm banks and donating. We'll get donor embryos donated from our fertility patients who have completed their family, but then have leftover embryos, and they don't want to discard their embryos, so they donate them for other couples to use. The treatment for donor eggs would be appropriate for anyone who needs an egg, and so it could be a same-sex male couple. It could be an older female whose eggs aren't viable anymore. And also it could be a younger female whose sometimes eggs will become less viable because of genetic issues. Donor sperm is typically used for couples if the male partner isn't making sperm, or for single patients who might need sperm to fertilize the egg, or for same-sex couples needing sperm. Donor embryos are used for either a couple who may need an egg and a sperm, and also for a single patient whose eggs may not be viable, needs donor sperm as well, so she might elect to go with a donor embryo.
The donors do go through a pretty rigorous screening process to ensure that they are healthy and fertile. However, obviously there's more to choosing a donor than just that, and that's really up to the patient. She may choose someone based on their background, their ethnicity, what their hobbies are, what they like to do. I find that most people are choosing people similar to them. Really the first step is to talk to a fertility specialist because they'll be able to kind of counsel you and put you in the right direction.
Smile for the camera.
There you go.
Well, I came to Dr. Fertility because I knew I wanted to have children. So I tried IUIs first. I did about 5 of those with no success. So I moved on to IVF. With the last IVF, I didn't have healthy eggs, and so I was just wondering what's next. That's how I got little Sadie here. It was from donor eggs. She was supposed to be a January baby, and she decided she wanted to come before Christmas. It can be hard and frustrating, but in the end, hopefully you can get what you want like I did.
This segment is sponsored by Fertility Institute of Hawaii.